Here to give us an update on vaccination efforts in Hamilton and answer some viewer questions is Dr. Mike West and Dr. Skylar Neblett. Thanks so much for joining us this morning.
Thanks for having us.
Yeah, good morning. Thanks.
We thought we'd throw a bunch of, we get a lot of questions on our social media that we wanted to pass along to the experts, but it's so important to, as we are trying to get to the metrics we need to get out of this, and the vaccination rates, we've been doing great, but we're not there yet. There are legitimate questions, and of course they have to be handled respectfully, but then there's also wild misinformation out there. It's a wild west, and that must be frustrating for you.
Definitely.
Yeah, it definitely is.
Yeah.
We're struggling in primary care to try to get the message through to everyone as best we can, using evidence-based knowledge and going to trusted caregivers and people that you know in the community to help you with your decision making.
Yeah, well, with that decision making, I know you're armed with the numbers for this first question. It comes from Tom on Instagram. Why get the jab if you can still get COVID?
That's a really great question. So I think the big thing to highlight is that with these vaccines, we know these vaccines are really, really effective at preventing severe COVID-19 infection. And by severe COVID-19 infection, we're talking about the vaccines preventing hospitalization from a COVID-19 infection or, unfortunately, death.
We have a question from Leafs Girl on Instagram. If there was a classroom case, who would the vaccinated teacher, rather, still have to quarantine?
I believe so, yeah. If there's a case in the classroom, we still follow public health guidelines. And if the teacher does test positive, they'll need to quarantine. As far as the kids are concerned in the classroom, that's a different matter. Depending on if they've been vaccinated, if they're wearing masks, I'd have to defer to public health to know what the current guidelines, and things might change by September.
Right. Now, Brian on Instagram is asking, my adult child has asthma and a severe peanut allergy. Is there any risk to being vaccinated?
That's a great question. So when it comes to contraindications for getting the COVID-19 vaccine, it's really with regards to an allergen specifically in the vaccine itself. So if you do have questions whether or not that you do have a medical reason why you shouldn't get the vaccine, absolutely makes sense to reach out to your healthcare provider, such as your family doctor.
Okay. Another question from Facebook. How well are people with autoimmune disorders protected with vaccines?
Well, good question. As far as we know, they're very well protected. There's a lot of concern about people and their personal health history, whether that's a reason that they're not going to get adequate protection from the vaccines. But as far as we know, there's very few reasons why individuals should not get vaccinated. And if you have an autoimmune condition, you should still get a good immune response. But as always, we recommend if you have any specific questions, talk to your specialist care provider. They can give you some more information.
Okay. We've had a number of questions just about the approval stateside, full approval from some of these manufacturers, like Pfizer, for example. They've applied in May, but don't actually have full approval on the vaccines. And is there a concern over vaccine hesitancy with that fact?
That's a really great question, and one that comes up a lot. So a lot of people do have a concern because they can feel that because there isn't the full approval that maybe these vaccines were rushed. But it's important to note that these vaccines were not rushed in their making, no corners were cut, and they're safe and effective, and that's why they were approved by Health Canada here.
Yeah, we've had, as mentioned, great questions on our social media. That's just a small number of them. Let's get into some of the misinformation that is spreading like wildfire on social media. And it really needs to, you can't ignore it because it just gets worse. It's out there. So this one, shedding vaccine material, there was a lot of comments about, there was concerns about impacting another individual's menstrual cycle because of shedding vaccine. And again, that's probably an example of biologically impossible, but again, that's out there. What do you say?
Yeah,
I can answer that one.
Please do.
Dr. West, yeah. So that is a myth. So with the COVID-19 vaccines, you don't get the COVID-19 infection, you don't shed the virus, and it doesn't alter your menstrual cycle that we've been able to identify so far.
Okay. What's the question you guys get most often asked about vaccines?
One question I get frequently asked is there's a lot of hesitancy or resistance to the vaccine because they feel it's been rushed. People feel it's been put through the system too quickly. It doesn't have a safety profile that other vaccines might have. But that's not true. It has gone through all the steps, checks and balances required for any safe vaccine, and Health Canada wouldn't approve the vaccines unless they were safe. The fact that we've got a vaccine available is quite remarkable and a testament to the collaboration between scientists and government to get this thing developed very quickly.
And Dr. Neblett?
Yeah, a question that I commonly get asked is, with the mRNA vaccines, is it going to alter my DNA in any way or form? Simple answer is no. Our bodies aren't able to have mRNA incorporate into our DNA, and our bodies actually break down the mRNA component in the vaccines within a few hours of getting your COVID-19 vaccine.
Yeah. Hey, thanks so much for your input and this information, much needed information, because it's so important. We're in the stretch drive here to get this thing in the rear view mirror. So thanks for your expertise. Dr. Mike West and Dr. Skylar Neblett, thanks for joining us on Morning Live.
Thanks for having us.
Thanks for having us.